We are going to be recording this today, and I have started that now.
Okay.
Good morning or afternoon, depending upon where you are in the country. We are excited to welcome you to today's webinar, Celebrando Familias, Celebrating Families for Hispanic Families. I'm Mary Beth Collins, the Director of Programs at the National Association for Children of Addiction. If you have any issues during the webinar, please feel free to message me privately in the chat box. We are excited to have you join us today to learn about this program and how we can help you provide whole family evidence-based recovery to the Hispanic Latino families in your community. Let me just take a few minutes to go over some basic housekeeping rules and we can begin. We ask you to remain muted when you are not speaking to cut down on sound disturbances throughout the training. Ask any questions you have in the chat box and we'll address them as we can during our presentation or at the time we've reserved for questions at the end. We want to address all of your questions, great and small, so please feel free to ask anything. I will post the meeting number, passcode, and call-in numbers in the chat box in case you wish to make a note of them. Remember that if you do run into technical difficulty, you can call back in for the remainder of the presentation. Handouts of the PowerPoint for this presentation will be emailed to you afterwards, along with some additional resources that we will be referring to and a webinar evaluation survey that we'll ask you to complete for us. So let me introduce you to today's presenter. Maria Ramirez has spent over 20 years at Uplift Family Services in San Jose, California, where she provides direct services to children and families in crisis. As a senior learning partner, Maria provides mental health professionals with the required onboarding and ongoing training requirements, including therapeutic crisis intervention. Prior to transitioning to learning and development, Maria worked in the foster care and adoption services program at Uplift Family Services for over 10 years and continues to be the primary trainer for prospective resource foster families in the area of parenting children with significant trauma. In 2008, Maria joined Addiction Prevention Services at Uplift Family Services and began leading Celebrating Families groups. Witnessing the positive impact the curriculum was having on families, Maria became increasingly motivated about making it available to the Spanish-speaking community. Eventually, Maria would become the lead adoption consultant for Celebrando Familias and was instrumental in the translation, adoption, and pilot of the program, which became available in 2012. In 2019, she did the same for Celebrando Familias, the 0 to 3 year supplement, focused on Hispanic pregnant mothers and families with children ages 0 to 3 years. In 2020, during the COVID-19 pandemic, Uplift Family Services was one of the first agencies to begin online groups for families during the shelter-in-place orders. Maria was instrumental in organizing and adapting the Celebrating Families curriculum for virtual implementation. Maria has continued to partner with NACoA to support sites and their Celebrating Families programs on the national level by contributing to the development of online training programs for group leaders and providing training to sites across the country. So without further hesitation, I'm going to pass this over to Maria.
Hello. Well, good morning, everybody, and welcome. Good morning for those of you who are on my side of the country, and good afternoon, and welcome back from hopefully a nice lunch. We're going to go ahead and get ourselves started here. We'll get the PowerPoint up and we'll get going.
One quick second.
Okay. Sandy, where are you at, Gail?
Also Oklahoma.
Also Oklahoma, okay. I trained out in Oklahoma some years ago. And Lisa, where are you?
I'm in Veneta, Oklahoma.
So Oklahoma is in the house today. And James, tell them where you're at.
I'm in New Jersey.
New Jersey. Wonderful. New Jersey, New Jersey. I knew you were in New Jersey, James. I didn't forget because I had to get up early to do the training for New Jersey. That's what I'm not going to forget.
I apologize. I'm having a little technical difficulty. I had some computer issues this morning, so just give me one quick second.
All right. It's okay because I can actually start talking now. So
Please.
we're gonna get started just by talking about the amount of growth in the Latino Hispanic population and the diversity of the Latino families that are in the United States. We're so diverse as the various people that make up the Latino Hispanic fabric of los United States. Let's start with that. So here we have an agenda. We're going to talk about Hispanic Latino families and addiction. We're also going to look at some of the unique vulnerabilities for Hispanic Latino families and some of the preferred methods that we want to use to support Hispanic Latino families in their recovery journey. And also talking about Celebrando Familias. Some of you might already be utilizing Celebrando Familias, and certainly the strength of the program when supporting Hispanic Latino families. And now we'll get into talking about the growth of the Hispanic population in the United States. And I mean, just by looking at this picture, the generations, the first generation, second generation, third generation Latinos. One of the statements that we put on here is one that I appreciated from SAMHSA that said, we're a whole spectrum, and we are a whole spectrum. You have families that are recently migrated to the United States that are monolingual speaking. We have families that are bilingual. We have families where we have a parent who is monolingual Spanish speaking and the children are bilingual. We have English dominant families. And so we're quite diverse. One of the things that I was reading is that we also have now what they're calling the millennial Latinos. And the millennial Latinos are sort of creating a pathway for other Latinos with they become acculturated and they start to adopt some of the American traditions and so forth. And so there's more talk about those millennial Latinos coming in. It's estimated that 51% of the US born Latinos are English dominant, but we still have new families that are coming to the United States that are migrating into the United States. And we have the mixed status families, right? Where we have an undocumented parent with the US born children. But one of the things to think about also as we see this growth in families is that often what can happen is that some of the children end up becoming sort of those cultural brokers for the families. They become the translators for the family. It's not uncommon for children to be used as translators. Whether it's a doctor's visit, filling out unemployment paperwork, accessing technology. So one of the things to think about too, as they're handed this responsibility to take care of some of the adult matters in the home, is that it actually is one of the risk factors, because there's a sense of responsibility that they have to take over. And unfortunately, the pressure and the negative feelings around having to take on that responsibility are associated with higher levels of stress and also risk for engaging in substance use. We also know that Hispanic teens are more likely to abuse illegal drugs and legal drugs than their Black or white peers. So it's important to to know that and to understand that. and to recognize that again, that the families are so unique and diverse. I saw James. What is that? What is what? Tell me.
No, you were saying that his Hispanic teens are more likely to abuse illegal and legal drugs, opposed to other teen. I was just wondering why. I've never heard that before.
Yes, and in fact, I actually have the numbers. In comparison to their Black peers, 54% versus 45% of Black young people, and 54% versus 43% of their white peers. And so they are much more likely. So that's what makes them more vulnerable. And when you think of also the family trauma, as I go through this, when you think of the family trauma, so we have the family's original reason for leaving their country of origin, right? So we have families that are leaving there for different reasons, whether it's related to poverty or civil war or a natural disaster, or maybe they already have family here that they're trying to reconnect with. Then you have the experience that they have during the migration. We know that a lot of them often, I know for us here in California, the border is very close. So many people lose their lives trying to get into the United States. So people have different experiences during that migration process that can be traumatic. Um, the trauma of leaving the country of origin where they came from and often leaving loved ones, trying to, you know, uh, assimilate to everything that's new, different here, the acculturation process, the language barriers that they encounter, um, trying to work here in the United States, depending on what skills they might have. Often they end up in a lot of the, you know, essential worker positions, which I will talk about a little bit later. The fear of the immigration fears, fear of detention or deportation. Um, and one of the things that that I also want to mention is that research also indicates that in general, migrants who are fleeing persecution have high prevalence of mental health, including anxiety, depression, and PTSD. Go ahead, Mary. But yep, you were right on it. I saw you. This is actually from the 2019 National Survey on Drug Abuse, specifically looking at Hispanic Latinos. And if you look on here, it tells us, you know, 2 in 5 Latinos struggle with illicit drugs, 3 in 4 struggle with alcohol use, and 1 in 8 struggle with illicit drugs and alcohol. So both of them. And then among Hispanics with mental illness, 1 in 4 had a serious mental illness. So if you look right down below, it's showing us that in 2019, 18.9 Hispanics adults had a mental illness and or substance use disorder. And so, you know, the numbers really, when you look at them, they're staggering. I don't want to leave out because it's talking about 18 and over, but in 2019 as well, 12 to 17 year olds had an increased use of alcohol in comparison to 2018. They say that it's still stable for Hispanic Latino youth, but it's still an increase. It still went from 7.4 to 10%. So when you think of, you know, the acculturation process, the fact that a lot of Latinos are also struggling with having to take the responsibility of being responsible for all of the matters that the parents may not be able to do because of the language barriers. Again, it creates a higher risk for them. Next, Mary Beth. So one of the sad things is that within our culture, um, just like in the general population, stigma in the Latino Hispanic communities, addiction is still viewed as a moral failure. And they don't look at it as what we know to be a chronic brain disease. So they're still not getting the message that this is a chronic brain disease and don't have an understanding of that. And so again, looking at that as a moral failure. Just last night, I was running a group for Spanish speakers, and we were talking about this specific subject matter, and we were working through one of the handouts, and I was explaining how you know, dopamine works, and you know, the pleasure hormone, and we had a really rich discussion about it. And one of the parents in that group said, so if a parent uses heroin, is that going to have an effect on their child? And so we had a discussion about that. But one of the things that she said right before she asked the question, she said, I'm very embarrassed to ask this question, but I want to ask because I'm worried. And I have to think that part of it is that stigma and the fear of, you know, not understanding and not knowing that it was a brain disease. I think that she felt more comfortable asking when she realized this is not something that I can just control. I know that I love my children, but now I'm understanding that it is a brain disease. And so the fact that she was able to be vulnerable enough to come forward and say, I have a question, even though there was some embarrassment. She asked the question, and then we were able to talk about some of the things that she will be able to do because she's equipping herself with that information and also understanding addiction as a disease. And so there's still a huge lack of awareness, not just about you know, the diagnosis, but the treatment and the things that they can do to prevent and to get the support and the access to the services that they need. Go ahead, Mary Beth. There's this intersectionality, you know, a heightened vulnerability of addiction in Hispanic Latino families. One, because of what I just talked about, just a lack of education of the disease, not understanding that it is a chronic brain disease, not knowing that there are resources or not having appropriate access to care. And when they do have access to care or they find a way to get access, then the challenge becomes, do I get in language support? Do I have people that I can speak to in my language? And do I have the materials, the handouts, the forms, are they available in Spanish? And certainly we can't deny the stigma about addiction, and again, looking at it as a moral failure. Go ahead, Mary Beth. Now with the pandemic, this has really, I mean, it's impacted the nation, but yet for us, we're especially hit hard by the pandemic. And when I say us, I'm talking about us as Hispanic Latinos. We're impacted by the pandemic because often we're in positions where, or a lot of the families are in positions where they are essential workers. So they're much more likely to have exposure to COVID-19. There's also the CDC found that Hispanic Latinos have a higher prevalence of symptoms of anxiety, of depressive disorder, COVID-19 related trauma and stress, um, suicidal ideation. They were also reporting higher levels of increased suicidal ideation in Hispanic and Latinos. That information is also coming from SAMHSA. And so we are much more vulnerable. We're at increased risk for exposure because we are often essential workers. So we don't have the luxury of sitting home and using technology in order to do the jobs that are needed. There's disparities in access to care. And then again, we go back to, if they do get care, are they, one, gonna seek out the care? Two, then get care where there's culturally and linguistically appropriate services delivered to the families. And now we also know that because the children are home, the children are also now having to take responsibility for their younger siblings in the home, taking responsibility for ensuring that while the parents are gone to work, that they are making sure that the siblings are logging on to their classes, doing what they need to do, making sure that they're also eating while they're at home, because the parents are essential workers and unable to be home. So I hear a lot of stories about the children having to take on the responsibility of the care for the younger siblings while also trying to do school themselves. And so again, makes us so much more vulnerable. So this, they talk about the pandemic being one of those global ACEs. And when you think of the global ACE of the pandemic, and then we start looking at just ACEs in general. So you could go to the next slide where we talk about, nationally, 51% of Hispanic children have experienced at least one adverse childhood experience. So at least one ACE, compared to 40% of white or non-Hispanic children and 23% of Asian non-Hispanic children. So when you start to factor in some of the other things that may be happening in the home, we know that also with the pandemic, there have been more cases of domestic violence in the home. Parents also are often, that there's a correlation between domestic violence as well as abuse to children, which also then, you look at neglect. And so we have the global ACE of the pandemic, with also some of these other things such as substance use happening in the home. So it goes on to tell us that most common ACEs for all races and ethnicities are economic hardship, divorce or separation of the parents or the guardian, the individuals who are taking care of them. When you think of Latino Hispanic families, we have a blending of families. So we have grandparents and multiple families living in one home. For Hispanic children, the next most common are living with adults that have a substance use problem, as well as incarceration of at least one parent. So even though as Hispanic and Latinos, we do have high rates of abstinence from alcohol, we also tend to consume higher volumes of alcohol than non-Hispanics. And so the numbers are certainly, unfortunately, increasing. Our youth are at high risk. One of the reasons is, I mentioned earlier, the acculturation and immigration issues that often manifest themselves for immigrant youth. And so they report higher levels of anxiety, symptoms of depression, PTSD. Also, for Hispanic Latinos, 8th and 10th graders reported opiate misuse in the past year in comparison to their white and African American peers. And so when you think of that, and also one of the things that I was reading is that some of the youth are taking medications that they don't look at themselves as this is a bad thing because it's actually a prescription medication. Some of them are getting the prescription medications from family members, including even grandparents who are giving the grandkids their own medications. And so, and they're not, the youth are not recognizing the risk in that. So you see here, you know, with prescription opiates. And so again, because you have these families often living together, if you have a grandparent who has a grandchild complaining of pain or not feeling well, one of the things that often happens is that that grandparent will give their own medication again to their grandkids, and they don't often look at it as a problem because it's a prescription medication, not recognizing that it is still a drug. So the standard, what it is that we want to do. We want to provide effective, equitable, understanding, respectful quality of care and service to all of our families that we serve, where, you know, you have bilingual staff members. We can speak to them in their native language, or we can find, we've had groups or we've had people come in to do translations when there's been a particular dialect that they speak, and we've been able to find translators for that when we have not been able to provide services in Spanish, or they had a specific, again, a dialect. So it has to be linguistically appropriate in order to provide appropriate service. We could move on, Monica. So there's so we have to figure out who our families are. How do they show up? There's familismo, which essentially is the internal family culture. So what is the family? What are the family dynamics? What are the family values? What are the family roles? How do they celebrate? It's understanding all of these things because our families are so unique, and it's critical if we really want to work with the whole family and really provide that, not just the prevention, but the treatment and the different recovery approaches for the Latino families. So it's really important. One of the words I always use is, first thing we have to do is be able to develop trust with our families. Otherwise, none of the things I just talked about earlier can happen. If they don't feel comfortable with us, they're not going to share. I felt incredibly, I don't know what the word is, if you want to say proud or relieved, when last night the woman came forward and said, I'm very embarrassed to ask, but I'm going to ask anyways. What that told me was that she felt a degree of trust in that group, and she was getting the support, not just from myself as a group facilitator or a group leader, but from the other individuals who were in the group. It's not a very large group, it's about 8 people in the group, but they've come to know each other and the trust has been developed within the group. And so that really is the essence of what we want to be able to do with the families, is develop that trusting relationship, because if we don't develop the trust, none of the others things will follow. Go ahead, Mary Beth. So we know that religion, over 80% of Hispanic Latinos identify with a religious practice. And we want to be able to recognize that, but also figure out ways that the family is able to sort of fold it in to that treatment. So how can we take their faith and spirituality and utilize that as a way that the family can use it in their treatment process or in their treatment plan, and as an intervention for themselves and their children. One of the things that they're doing right now during the pandemic, they're having virtual sermons. I myself attended a virtual rosary for the first time, which when I first heard it, I thought, oh, that's going to be really interesting to kind of see how it goes. And it went really well. But I want to mention that because they're now also doing Bible studies virtually. They're doing other online gatherings. And we have to be able to draw, because that's where families are having a sense of hope and a sense of community for themselves and for their families. So being able to figure out ways in which they can utilize that as a source of support. Yep, you knew it. So addiction recovery for Hispanics. It's really hard. Oh, Mary Beth, I'm having a hard time reading it because it's yellow. But I'm seeing here it's about providing an honoring, inclusive approach towards the family's self-identity as Hispanic and Latinos. Again, it goes back, I think, really basically to what I was saying earlier, is that our ability to develop a trusting relationship. We do this in different ways, but I found now that I'm doing virtual groups, I am texting and calling more than I ever have texted and called. And so the personal notes and text messages, if they are coming to your current group, I send them reminder messages letting them know that, hey, today is week 8, we're halfway there, right? Keep coming back. I also start messages off with, hola, increíbles padres. Hoy es semana 8, right? So I include some of those messages where I am giving them affirmations, because if I'm expecting for them to report back some of the affirmations they're giving their children, I want them to understand how an affirmation is also so important for them. And I also get sometimes messages back like, thank you so much, and thanks for reminding me. But I think part of it is because there's a connection that's being developed there because of the group, but also because of the affirmations that I'm sending to them. Creating a sense of culturally sensitive connection to the community. Latinos rely on community for a lot of the things that they do. And so we are a part of that community. So helping them to understand that we create that safe space for them as well within the group, and that this is a place where they can come and talk and share what their experiences are. But I think especially for families who are Latino and Hispanic, because there is so much stigma around it, our ability to create that sense of community within the group is incredibly important for them. And in fact, I think it's often what keeps them coming back. Certainly much more effective when they're provided in Spanish. Many years ago, I worked at another nonprofit agency where often we were told, well, just you'll have the handout in English and you could just do the translation for them in Spanish. So they didn't really have anything that they could look at and reference. They had to rely on me as a translator. And they also didn't want to, well, not that they didn't want to, but they had a difficult time finding the funds that they needed in order to do the translation of the documents. And so often, when those things happen, at agencies, the families become discouraged because they don't get any takeaways. They don't have anything that they can hold on to, that they can refer back to, that they can then later read at their pace. And so it's important for us to be able to do that and to provide that linguistic support. Intimate engagement, again, it talks about that person-to-person encouragement. So sending, again, especially right now during the pandemic, those messages are important, connecting with those families, finding ways that you can connect with them. Sending the personal notes is something else that I've done, where I sent them in snail mail. I joke with my cousin that we're bringing snail mail back. But all of those little things that we do, again, helps to create some of that engagement. Individual family support for the entire family. So we know that families do better when they engage in the process together. And that's the beauty, I think, of Celebrating Families, is that we look at whole family care. Everything that I was reading prior to preparing for this, it talked about the programs that had the most success were the programs that offered whole family care or whole family treatment. Those are the programs that often work, where the young people were also getting information that the parents were getting. In Celebrating Families, that's exactly what we do. Whatever topic we're covering for the adults, we know that the children are getting that same information. And so they're all essentially learning together. It is helping definitely with reunifying families. It's happening a lot, often a lot sooner. I had 2 families from the English group who reported that they're going to get their kids back sooner than they had expected. And a lot of it has been due to the fact that, one, they're doing all the things that they're being asked to do, but their participation in Celebrating Families has also helped. One of the things that the parents have shared is that sometimes they'll take the actual handouts of the work that they're doing in Celebrando Familias and showing it, or Celebrating Families, and showing the worker, look, you know, we worked on this week, and I am now, what I have prepared for when my children come home is that we have certain agreements that we've all talked about, so that we can, when we are to get back together, that we're going to all be working off these agreements together. And the social workers are, for the most part, they're engaged in the process in terms of, understanding what the families are doing and hearing from the families about how they're doing and showing their success. Okay, we can move on. And of course, Celebrando Familias, I couldn't be prouder to be a part of the process of Celebrando Familias, because now we are providing cultural and linguistic service to our families. And so I could not be more excited about, again, being a part of that process. And I have now been able to witness the success of Celebrando Familias. I knew that when I started, that this was going to make a big difference. My family is impacted by addiction, and there are many families impacted by addiction. And even though there's a stigma out there, when we have families coming in, we have families that are part of the family court that are referred to Celebrando Familias. And so they have now, been impacted by this disease, and now they're required to come to Celebrando Familias. But the beauty of Celebrando Familias is that even if they come in with hesitation or resistance, usually by the first 3 weeks, they're full on committed to the Celebrando Familias process. And I think a lot of it has to do with the way that Celebrando Familias is set up. And so absolutely, Mary Beth, you're right on. it's the way in which we do, in which we deliver the program of Celebrando Familias, where the first weeks are really about, hey, let's build trust, let's get to know each other, let's get to find out who else is in the group. We talk about healthy living. The healthy living circle is utilized as part of that. And I think when you look at some of those, when we talked about earlier about familismo, the healthy living circle is a very good way to find out about families and about their celebrations, how they socialize, how they reach out, what support are they getting in terms of their psychological health, their spiritual, and their physical. What are the things that the family is doing? And then we start talking about the nutrition and how nutrition, affects everything that they do for themselves and for their children. And then we start talking about feelings and communication and how we're communicating and our different styles that we have as parents. And what I appreciate about this is that you can see as I'm going through this, we're not starting off by, hey, let's talk about addiction in your family. We're starting off by developing a relationship, talking about some of those important themes initially, such as healthy living and healthy eating and communication. Then we start moving into, okay, let's talk about this emotion, this one specific emotion around how we might be handling anger. And then moving on to talking about, let's talk about some facts first about alcohol, tobacco, and other drugs. Then they're getting information, right? And then we start talking about addiction as a disease. They really start to look at that and how it affects the whole family. And I had an interesting situation. I'm just going to go off just for a quick second. I had a small group this week. I think I had 5 people, and I was thinking, how am I going to do this role play? And so for the first time, I did the role play highlighting the first 3 characters, which was the person who developed the problem, the person who was a family member, and then the hero. And then I spoke about the other, we talked about the other roles. And so everybody kind of chimed in and participated in talking about the other roles. But we were able to get through it, one of them, so we can use some of, we have to be a little bit flexible and we have to kind of roll with the punches. But what was interesting is that by the time we're having this role play and this discussion, we've already learned the facts. And we understand it better, and we're understanding that it is a brain disease. So we're feeling much more comfortable talking about it because I could see it as a disease and not as a moral failure. And then we move into creating goals, not just individual goals, but what are the family goals and how we get to those one step at a time. How we make healthy choices and practicing some of those healthy choices, healthy boundaries. Relationships are huge. One of the things that often comes up about healthy relationships and friendships is that these can be risk factors for a lot of the families. And so being able to talk about it as a risk factor, and talk about what are the things that we might be able to do because our children are going to be impacted by the choices we make, and then understanding how we learn, and their own uniqueness. And then of course celebration, which we're doing in so many different ways now, but we're still celebrating families when they finish the program, and we're finding very creative ways to do that. Go ahead, Mary Beth. So the emphasis really is on the family, treating, as I mentioned earlier, treating the whole family. The family meal is an important part of that. We're using a lot of different ways now virtually for sites to do the family meals, spending quality time together, and having conversations about how the families are doing that. Traditions, celebrations that families are having, that they can have that are alcohol free. The good thing is that when you develop the relationships with the families, myself as a Latina, I'm able to say, and this is why working with Latino families, it makes it easier for us to say and call it out. We often bring alcohol to parties, and I've heard families make statements like, if there's no alcohol, there's no party. And so we're able to talk about those things openly because being Latina myself, I know what the celebrations often can look like. Not always, but a lot of times, especially in children's parties, alcohol is the first thing to get there. Building trust with the families from the get-go. Again, that trust and those interactions are going to be important. Go ahead, Mary. And then emphasizing all of the healthy living skills from nutrition, utilizing again the healthy living circle, equipping them with the education and information about the disease, understanding their risk factors, as well as the things that they can do to create the protective factors for their families, and as well as healthy living and healthy relationships. This is one of my favorite pictures because centering is important for the families. And the beauty of it is that they learn it and they actually practice it at home, and they tell me about the times that they use centering. But this image is from our pilot program that we did years ago, where at this particular school, they could not have the children that were 3 and under in the classrooms. They had to stay with the parents. So this little guy in the middle sitting in between the parents are centering, but after a few weeks, he just started centering with us. So I always say, if a 3-year-old, he doesn't look 3, but he's 3. If a 3-year-old can center, all of us can center, because I know sometimes that's a challenge for folks. Yeah, go ahead, Mary Beth. Okay. The wow moments, capturing those wow moments. I love hearing from families when now that they're in their recovery journey, just the fact that they are now recognizing all the beauty in the world and really taking in those wow moments, from nature or from things that we witness, and reporting back and talking about them. And sometimes it simply is just hearing their children laugh for the first time while they're present and sober. Yeah. It is designed, Celebrando is designed to support reunification, working with the drug courts. We know that it is best practice. And so we definitely are working together. Parents that I've had in my groups speak volumes about being involved with the family drug court, because they're encouraging them to come to Celebrating Families. And I've had a lot of parents who also are doing other classes, but one of the things that I hear repeatedly is that this is one of the classes not only that they appreciate, they actually enjoy. They're not like, oh geez, I got to go to that class. They're looking forward to the class. And some parents even report, at least when we were doing classes in person, that sometimes the children would be the ones to say, we have Celebrating Families tonight and we have to go. So sometimes the children were bringing the parents to the classes. Implementation of Celebrando virtually is still working. It's incredible to me because I was one of the naysayers at the initial start of the pandemic. And when they told us, you're gonna run groups virtually, the first thing I said, that's not gonna work. But I've been surprised at how well it's worked. And I think a lot of it has to do with the fact that we're making those connections. We're still utilizing building relationships with families one-on-one, creating that engagement, which then when they come on the screen, they know who to expect. They know who they're gonna see. The group leader is Spanish speaking. And so it's still working despite the fact that we're distancing. So please don't be afraid to do it, just do it. I think that's what really ended up happening. We do have a webinar that's going to be provided in Spanish It is coming up on Friday, April 19th. So I encourage all of you to share this information. If you have group leaders that are Spanish speaking, please invite them to come to the Celebrando Familias webinar on that date. And certainly also we invite you to look at those consultation bundles that are 3 hours and they're available. You can talk to Mary Beth or send us an email and let us know that you're interested in one of those bundles. So some of the things that we know are now also available in Spanish are the developmental assets. You could see here the names on the right-hand side in Spanish. Plaza Sésamo, Sesame Street, wonderful resources now, videos and resources to help children understand and look at addiction as a disease, as a brain disease. A kissing hand, or un beso mi mano. Have you filled the bucket today? Didn't used to be in Spanish and now is available in Spanish. We used to have somebody one of us would translate ACEs handout. And in fact, this ACEs handout that is in Spanish and in English, this is a handout that's so easily understandable. I would make copies for parents as well. Toxic stress video, where they talk about how this derails development, also available. The baby cues, the cards are also señales de bebé. The DVD is now also, it didn't used to be available in Spanish, it's now available in Spanish. And the worksheets that they have for the cards are also now available in Spanish. So we're at 10:57, Mary Beth. Isn't that wonderful?
Yeah. So these are all the resources that you will be receiving links to after the webinar. If you want to explore anything here, it's a rich list of resources to learn more about the interaction of Hispanic Latino families and addiction and how to bring recovery to those families.
Yeah.
So do we want to open up? Does anyone have any questions for Maria? We didn't receive anything during the webinar. Did anything come across anyone's mind while they were listening to her speak?
For me, it's you know, both of my parents, came to this country, later in their lives, and so I identify a lot with sorry. So I identify a lot with growing up in that culture and being surrounded by it and all the challenges and struggles. But after this webinar, there's so much more to it that I wasn't aware of, familiar with, and it's like even more stress, even more things that they have to deal with and battle, things that people don't see. And I like to help people, but I think I want to start focusing more on just working with Hispanics, if I could, uplifting that community.
Absolutely. You know, James, when I was preparing for this, I was having discussions with my own husband, and it was when I was sharing with him the information that I was finding, it really impacted us because we didn't realize how vulnerable we were as Hispanic Latinos, but we also have young children we're worried about. Yeah. Who are at higher risk.
I have a few questions. Overall, like I started this program back in 2 weeks before we actually started the program, and specifically we only do Spanish speaking classes here, and we do Zoom meetings. Eventually we're going to start bringing people back into the agency, but for us right now the struggle is having the younger 3 to 6. 7 to 12 join the classes, because the parents are interested in joining. I don't know, and we've told them, I mean, we're doing it differently in that we're giving them like $25 gift card instead of the meal. So just to have it picked up, or I can deliver them electronically. So there's an incentive. So I know that. And most of the adults have built a relationship with me. Same way, I came from the same thing. So most of them are very similar to my family, to what I grew up with, my parents, I don't know how to get this younger age to join, specifically in that they don't think they need it. Whenever I stepped in as a facilitator, a lot of the kids from 7 to 12 said like, well, my dad doesn't do that. Or my family, they only drink alcohol, and stuff like that I didn't know how to address and say, hey, no, that's actually an addiction, so I don't know if you guys have any tips or any sort of experience that you guys could help me out with. Like I said, I just started this program. I didn't know it existed before I even got it. I'm working as a case manager, but this program I really liked, and it's helped me identify a lot of the things that I could have had, or the help that I could have needed whenever I was younger. But yeah, I'm open for suggestions.
Yeah, so there's a few things that I'm thinking about, and one of them is, that common misconception, and that's exactly the language that I use. I tell them that's actually a common misconception. A lot of people think that, and then we have a rich discussion around, well, let's look at what the definition of addiction is, and then we could talk about, addiction itself. Then we move into specifically what information we need to make sure that they get. And it doesn't have to be, that's the thing with the way in which we communicate with families. Being Latinos ourselves, it makes it easier for us to have the difficult conversations sometimes with the families around, there's a statement from one of our families who came to class as a volunteer, and it's sort of the same idea, Lorena, where, oh, it's just alcohol, it's not really a problem. Or my dad, he just drinks after work. But they don't realize that that's still regular drinking, and that's still considered alcoholism, right? That they are still. And she said, after she did the class, she goes, I realized my dad's an alcoholic. And she was an adult mother herself now too. But I think that's why the importance of us being Latinos ourselves is for us to be able to give that information in a very respectful way, which we always, right? Like that's huge for our culture, but we still have to deliver the information. And then there was something else that you were saying about the younger kids. One of the things that you can start doing, and I don't know how it'll work, is we've had kids who come in and join with the parents during the group, but not as a full children's group, but doing certain activities with them together. If you could figure out a way how to get them on the screen to do the activities with them, even if it's a short one that you would have covered otherwise in the children's group, that's one of the ways that we're kind of, I've done that with the families, where I say, bring them on and we're gonna read a story together. And they're engaged because you have your, like I have in Spanish, have you filled the bucket? Lo vamos a leer juntos. So todos tienen que estar en la pantalla, right? So, and they come to the screen and we just do the book. So starting off that way, because it's been a real challenge for us to run the children's groups all off on their own. But when the parents are on the screen and then they call the kids in for the last 10 minutes to read a story and maybe talk about it for 5 minutes, they're more willing to do that. And it's difficult because, right, engagement for younger kids, that's a real challenge. Yeah.
Another thing that I would throw in is we host discussion sessions so that sites have an opportunity to get together once a quarter. Next week is when we will be holding the discussion session during March, and we're actually going to talk about preteens and adolescent groups. So that might be a great opportunity for you to come and hear and discuss with other sites what they're doing. And then in June, we're actually going to talk specifically about Celebrando. So you'll have some opportunities both in March and in June to talk with other sites about what's working well with them, kind of pick their brains and share the things that are working well with your program.
Thank you.
Yeah.
I want to be respectful of everyone's time. Like I said, you'll be getting an email soon after this ends, and we'll ask you to complete the evaluation survey, and we will provide a number of resources, that whole list of Spanish resources that Maria read off to you, and the registration for the discussion session for next week. And you'll have my email. It's here, and it'll be an email that I sent you. So if you have any questions that occur to you after this is over, please don't hesitate to reach out. That's what we're here for.
Yeah.
And we appreciate your attendance today. Have a wonderful afternoon.
And feel free to invite all your Spanish-speaking group leaders to the webinar.
Thank you for the webinar.
Thank you, James. It was nice to see you.
Wonderful to see you again, James.
See you
Mhm.
next week, all right?
Okay.
Thank you, guys.
Have a
Thank
great afternoon.
You
you.
too. Thank you.
There we go.